Hello. Welcome back to Childhood Psychopathology. Today we're going to talk a little bit about how we approach preventing and treating childhood disorders. And it's important to understand some of this has to do with parenting, some of it has to do with environmental issues. We're going to talk this semester a lot about things like socioeconomic status and poverty and how we might intervene in order to prevent some issues coming up later in life due to those phenomena. So let's start off by thinking about the efficacy of psychotherapy in children and adolescents. We always want to focus on evidence-based practices. One of the things the textbook I'm using in this course does is it refers a lot to psychodynamic and psychoanalytic treatments. We're not really going to be talking about those because there is very little evidence for their efficacy, particularly when we're talking about an infant and trying to get them to sleep. Psychoanalysis and psychodynamic therapy isn't going to help us. So we're going to talk about how we do research on these kind of treatments. We want to think about outcome versus process. We always want to be focused on outcome, but outcome research has to do with whether children and adolescents have improved at the end of a treatment relative to their pre-treatment selves. But we also want to compare them to others who have not received treatment to make sure it's not just some sort of developmental process. Excuse me. Allergies are kicking it this morning. Anyway, so just doing pre and post treatment research doesn't always necessarily get us where we want to go. And so you might take a look at my quasi-experimental designs lecture to think about how we might design some of this research. Process research deals with sort of specific mechanisms and common factors which account for therapeutic change. So we're going to think about what's the specific process we might get involved with. We're going to be talking this semester a lot about cognitive behavioral therapy. Hang on. Okay, so as I was saying, we're going to be dealing with a lot of cognitive behavioral therapy and specific behavioral techniques. So, for example, in an upcoming lecture, we're going to talk a little bit about how we kind of recondition kids to not be fearful about eating because sometimes they'll have traumatic events like esophageal surgery, something like that, and then they have sort of fear about what's going in their mouths. And so we have to kind of condition that away in some specific ways. But the biggest thing here is it's always evidence-based practice. It's always what we want to focus on is evidence-based practices. If there's not evidence for it, we don't want to be engaging in it. So, we're going to talk about primary, secondary, and tertiary interventions that are related to timing. So primary prevention involves reducing or eliminating risks, as well as reducing the incidence of a disorder in children. So, for example, we're going to be talking very soon about cognitive developmental issues, and we know one of the biggest risk factors for that is something like lead. And so one of the things we have to do, of course, is prevent exposure to lead. And so we want to think very hard about how we do that. And of course, recently we've had a huge issue with that in Flint, Michigan. And so that's the kind of societal primary prevention we want to engage in. Universal preventative measures are provided for entire populations, theoretically. Mandatory immunizations for children are universal preventative measures. Eliminating lead-based paint are universal preventative measures. Supposedly in the United States, we're all supposed to have safe drinking water. Unfortunately, we're starting to learn that there are still lots of lead pipes, etc. In fact, the house I live in right at the moment, Denver Water is getting ready to do some work. And as a result, we're drinking filtered water because of the potential for lead contamination. Selective preventative measures are provided for groups at sort of above average risk. So these are the kind of things we might talk about in at-risk groups for who are in things like violence-prone regions, so places where there are civil wars going on. We might try to provide some kind of preventative measures for those really at-risk groups, people from other disadvantaged backgrounds, high levels of poverty, stress, etc. Things we can do to try to prevent some of the issues that we're going to talk about and try to get them every advantage. And then finally, indicated preventative measures are sort of much more specific, that include much more extensive interventions. And so we're going to try to really target those kind of interventions. There'll be things like services for families with premature infants. We might also do things like, I worked on a project in Texas involving going into homes, trying to do everything possible to eliminate risk for asthma. There's a lot of asthma down there. And so the group I was working with would go in and evaluate the home, try to figure out what they could do, make sure there are things like no pests, do pest control, try to eliminate carpets if at all possible, that sort of thing. So specific risk factors are things we're thinking about there. Secondary prevention has to do with interventions that are implemented following the early signs of distress and dysfunction. So here we're going to now get involved with early warning signs and try to prevent dysfunction in a specific child that is exhibiting those kinds of symptoms. So if we have sort of conduct disorder, attention deficit disorder, trying to figure out the nexus of that, what the etiology might be, and see if we can't deal with that issue. And so we want to think about that in children. And then tertiary prevention has to do with responding to already present and clinically significant disorder. Really, now we're at treatment. We're trying to prevent the disorder from having significant effects. So the targets we will have for kinds of interventions, of course, working with children. This is what we call the mental hygiene movement, child guidance clinics, working with the kids themselves, making sure they can understand what's happening if they are having some sort of disorder happening. So really working on propping up the kids themselves, making sure they're safe, making sure they feel safe, etc. We also want to work with parents and families, of course. Different parents and families require different helping strategies. A lot of families are strapped for time, for resources, and spending a significant chunk of time with a child might be very difficult. And so this is where we start looking at these issues with poverty and socioeconomic status. So for those of you who might go into therapy, you'll have far more advanced training in this, but certainly one of the things that's really important is relationships between therapists and parents. And so if you're a parent, you want to make sure that you're comfortable and have a good relationship with your child's therapist, because the two of you are going to work together to help treat that child. Of course, we also want to work with schools and communities. A lot of interventions are in schools and with the cooperation of school personnel. So these are things like nutrition. We often think about trying to improve nutrition by working with schools, making sure kids are eating, etc. They could be school-based, community-based, after-school, summer school. These can be in child welfare settings, juvenile justice settings. Really unfortunate once we've reached that point. But there are lots of these ways in which kids can get social support and nutritional support that they might need. And so these are all important things to consider. I want to briefly talk about some specific treatments we're going to get into this semester, and I don't have detailed notes here. I just want to speak for a moment. We're going to talk a lot about cognitive behavioral therapies. These are generally based in very clear evidence-based practices where we're trying to get kids to alter their behavior. So some of this is rooted directly in behaviorist techniques. Things like positive reinforcement, also some kinds of conditioning will also be involved, which sounds more onerous than it is, but it's things like getting kids to be able to eat because they are fearful because they've had some sort of dental surgery. Pardon the neighbor's dog barking if you can hear that. So those kind of cognitive behavioral therapies are important. So once kids start to get older, we start getting into trying to get them to think differently about how they're responding, trying to get them to change the way they react, that sort of thing. Pharmacotherapy is, of course, an important component of treatment. There are some serious issues with pharmacotherapy that we certainly want to discuss throughout the semester. First thing to keep in mind with pharmacotherapy in kids is they're not smaller adults. And that's oftentimes been the approach is, well, we'll just take the adult dose and downsize it for a child. And that doesn't work. They have different metabolic processes. And certainly when we're talking about psychoactive drugs, their brains are very different. They're still forming. And so we need to be mindful of the long-term versus short-term implications of some pharmacotherapies. There are certainly things that will be important to consider, and we'll talk about how they work with specific disorders. But just keep in mind, it's very different when we're dealing with kids. And we discovered that with some antidepressants that for some reason in kids, they might trigger suicidal behavior. We're not sure what the nexus of that is. And we'll talk more about that in more detail. Because one of the things that happened as a result of the issues surrounding those drugs is the kids were taken off of them, and actually teen suicides went up. So we have to really think very carefully. But it's something we want to talk about throughout the semester. Okay, well, that's a quick introduction to some of the ways we're going to talk about preventing and treating childhood disorders.